my thumb away, because the thumb's usually what contaminates you. Thumb away. Then I grab my catheter in my dominant hand, the hand I'm going to actually suction with. Hello, come on in.
Hi.
The water's fine.
Yay.
So take a deep breath. I'm going to grab my suction tubing with my non-dominant hand, and I'm going to connect it. And also, do you notice when I held the catheter out bag, I didn't take it out like this and let it hang, right? We don't want to contaminate, right? Because these things go and touch things. So when you take it out of the package, keep it nice and tight in your hand like that. Whatever way works for you, and that you can hold this part because this is the part you're going to connect to. So then we connect. And then I'm going to test it, make sure everything works well before I go into my patient. I'm going to dip it into my saline, a couple of times, kind of moisten it, kind of make sure everything's good. This is really, really important. When you check off next week or two, and or when you really decide a patient, have your thumb nowhere near the suction part when you're going in. Never suction going in. We'll tell you that, but you might forget, so just keep it away from there. And you let them know you're coming. They've just, pre-oxygenated themselves. How fast do you go in? Medium fast. You don't want to go too slow because you're taking too long blocking their oxygen. You don't want to go too fast. You don't want to be traumatic. So I'm going to go in. How long do I go in?
Till you feel an obstruction.
Or they cough. And usually they're going to cough. If you think about that tickly catheter, right? Usually they cough. So as soon as he coughs, I'm going to then apply suction intermittently, and I'm going to take my catheter up. You might see how I'm going to do a little rolling motion. Sometimes you have to do that just to kind of get the stuff out. I'm going to rinse. I'm going to go again. Take a nice deep breath, Mrs. Smith. Great. Here we go. Let's get that junk out for you. Thumb away. Going in. Meet resistance, or she coughs. Coming out. All right. Rinse it up. Do it one more time. Going in, resistance or coughing, suction, intermittently, coming out. And that's 3 times. Am I going to keep going?
No.
Why?
She don't want to damage the tissues or cause.
Well, you could. Or sometimes you do need to do more, but what do you need to do? You need to get another kit, because if you think about it, if I'm going in and out and I'm touching the chest out, could you contaminate? Yeah, you could. And then number 2, she needs a break. I've been blocking her, partially obstructing her airway for a little bit now. So I get my other kit or not. She takes a few breaths, and you assess. Do I need to go again, or are we good here? And involve your patient in the decision making if you can. They're kind of helpless here, right? You got to give them a little bit of a sense of a control, a participation in their care. So she's suctioned and she's good. So now let's get to cleaning that dressing, changing that dressing, okay?
You would have done the mouth, right after the treat.
If you have to. That's a good question, Mr. Vargas.
Thank you.
Would you? So if you need to clean them out, I do have a hint about the mouth thing too. So if you want, you may or may not. If she needs it, great. If she doesn't, don't do it because the book said so, right? You're going to do what the person needs. You might clean their cheeks. A lot of times where the secretion stick is like at the back of the tongue there, like at the back of the mouth, and I can't quite bring it forward. So I might help her. You would never go down the middle and push that catheter down. I might sneak in the side. Behind your teeth, there's a little gap there, right between that and the back of your mouth. I might sneak down the side a little bit and get to the back of her tongue there a little bit. But good point. Now, I see some secretions here. Should I go back in?
No.
Why not?
You need a new kit.
Yeah, why? Is it dirtier in the mouth?
Yes.
Yes, we got all kinds of stuff in our mouth, right? Okay, very good. So that is suctioning. Any questions about suctioning? All right. We're done. One down, one to go, right? I don't know whose kit this was.
Is there a video on First Class?
I reloaded. I guess the video was loaded.
Mm-hmm.
I just reloaded it. Pause. I just